Hello everyone! Welcome to our discussion about asepsis and infection prevention. For the learning outcomes, at the end of this discussion, the students will be able to define relevant terms and conditions, explain the chain of infection, differentiate the three ecologic models of diseases, enumerate measures to control and manage infectious disease, and identify protective precautions. Nurses are involved in providing biologically safe environment. Microorganisms are everywhere. Although most are harmless, sometimes there are microorganisms that could affect one's health. Let's understand more of this as we discuss asepsis and infection prevention. So when we say asepsis, it means freedom from disease-causing organisms, okay? Medical asepsis involves all practices intended to confine a specific microorganisms to a specific area. It limits the number of growth and transmission as well of microorganisms. Sepsis, on the other hand, is the opposite of asepsis. Sepsis is the state of infection. Here are definition of terms and brief concepts. Infection means the growth of microorganisms in body tissues where they are not usually found. Infectious agent refers to as the microorganism itself. Here are the types of infection. When we say nosocomial, it means that this infection originate in the hospital. This can be developed during the client's stay in the hospital. We also have HAIs, or the healthcare-associated infections. Infections that originate in any healthcare setting and of hospital-acquired conditions. Endogenous means that this can cause nosocomial infections that can originate from the client themselves. Example, we have E. coli, which causes improper catheterization technique. There's also Staphylococcus aureus that caused by inadequate hand hygiene, especially when there's surgical sites that have been touched or patients who had pneumonia. Next type is the exogenous. Okay, so when we say exogenous, this can cause nosocomial infections from the hospital environment and its personnel. A iatrogenic infection is the direct result of diagnostic or therapeutic procedures. For example, bacteremia that results from an intravascular infusion line. Next, we have local versus systemic infection. So when we say local infection, it's limited to the specific part of the body where microorganisms remain. For example, we have abscess, urinary bladder infection. Okay, systemic, on the other hand, is the microorganisms that spread and damage different parts of the body. For example, arthritic swelling, and those patients with HIV or human immunodeficiency virus. Another is bacteremia versus septicemia. So when you say bacteremia, the culture of the individual's blood reveals microorganisms, okay? And septicemia, rather, okay, is a systemic infection resulting from bacteremia. The most common infections that led to septicemia include UTI, lung infections, or kidney infections. Next, we have acute versus the chronic infection. Okay, acute infection appears suddenly, okay, and can last for just a short time. In contrary to chronic infection, this may occur gradually or slowly over a long period, okay, and may last months or years. So those are the definition of terms and basic concepts or overview. Now let's discuss the chain of infection. So when we say chain of infection, okay, there are various elements, and these are infectious agent, reservoir, portal of exit, mode of transmission or method of transmission. We also have portal of entry, susceptible host. Okay, so let's describe each element. Etiologic agent refers to the number of microorganisms present. And it also deals with virulence and potency. And this is called pathogenicity, when this is the ability of the infectious agent to enter the body. Okay, and susceptibility of the host is the ability of the agent to live in the host body. Portal of exit from reservoir. Okay, so let's define first reservoir. When we say reservoir, this refers to the sources of microorganisms, okay? Common sources are humans, the client's own organisms, could be plants, animals, medical equipment, or the general environment, such as soil and water. The carriers are either human or animal reservoir of specific infectious agent that usually does not manifest any clinical signs of disease. For example, you have Anopheles mosquito reservoir. It carries the malaria parasite but not affected by it. So, before an infection can establish, okay, microorganisms must leave the reservoir. Next, we have the method or mode of transmission. So, we have direct, indirect, and airborne. Okay, so direct transmission involves immediate and direct transfer of microorganisms from individual to another. Okay, so it is through touching, biting, kissing, or sexual intercourse. So, next, we have indirect transmission. So, when we say indirect transmission, it's either vehicle-borne or vector-borne. Vehicle-borne transmission, okay. A vehicle is any substance that serves as intermediate means to transport and introduce an infectious agent into a susceptible host. This is through a suitable portal of entry. For example, food or water may become contaminated by the food handler, okay, who carries hepatitis A, and could be ingested by the susceptible host. Vector-borne. Okay, so a vector is an animal or flying, crawling insect that serves as an immediate means of transporting the infectious agent. The transmission may occur by injecting salivary fluid during biting or by depositing feces of other materials on the skin through bites or traumatized skin area. Lastly, we have airborne transmission. When we say airborne transmission, this may involve droplet nuclei. Okay, so the residue of the evaporated droplets emitted by an infected host, such as someone with tuberculosis, can remain in the air, okay, for long periods. So, the same is true with COVID-19. Now, let's have the portal of entry to the susceptible host. So here, the skin, take note, is the barrier to infectious agents. So, any break can readily serve as portal of entry. Microorganisms often enter the body by the same route and they used to leave the same source. So also take note that medical interventions can also be the portal of entry, and it could be tubes, catheter, okay, cases of patients who have surgical wounds. Alright, next we have the susceptible host. So it is called the compromised host, where this is actually the individual more likely than others to acquire an infection. So, variables could be age, very young or very old, okay, clients receiving immune suppression treatment, or client with deficiency conditions. Alright, so those are the elements of the chain of infection. And if it remains the same, that there's no treatment or intervention being done, then we cannot break the chain of infection. Okay, let's discuss more about the susceptibility to infection. These are the factors increasing susceptibility to infections. Okay, we have immunization. So when we say immunizations, it schedules an individual for actually greatest protection. It could vary from different age group. So we have 0 to 6, 7 to 18, or even adults. Older adults also can have immunizations. Okay, so immunizations can be given later if missed. Okay, so we also have here age. We've mentioned a while ago as part of the variables, the age. Take note that newborns and older adults have reduced defenses against infection. Newborns have immature immune systems and are protected by the first 2 or 3 months, okay, by immunoglobulin passively received from the mother. While older adults, okay, their immunity to infection decreases with advancing age. So, for instance, the prevalence of influenza and the potential cause of death, okay, can easily happen to them. That's the reason why the Center for Disease Control recommends annual immunization of influenza. Next, we have heredity. Heredity influences the development of infection that some individuals have a genetic susceptibility to certain infections. For example, deficient in serum immunoglobulin, okay, is necessary. Okay, any lack of this serum immunoglobulin, okay, can cause internal defense mechanism of the body to decrease. Okay, so have you been stressed out lately? So take note that stressors elevate blood cortisols. Prolonged elevation of blood cortisol decreases anti-inflammatory responses, it depletes energy, and leads to a state of exhaustion and decreased resistance to infection. Okay, next we have the nutrition. So, resistance to infection depends on adequate nutritional status. It's because antibodies are proteins. So, the ability to synthesize antibodies may be impaired when protein intake is depleted. Next, we have medical therapies. So, this predispose a client to infection. Alright, example, we have radiation therapy to destroy cancer cells. However, not only cancer cells are being destroyed in this treatment, but also the normal cells. Okay, so lastly, we have the pre-existing condition. So this is a disease or diseases that lessens the body's defenses against infection. Example, diabetes mellitus can compromise the peripheral vascular status and increase serum glucose levels. Okay, so this now increases the susceptibility of the host. Alright, so those are the factors that again influences an individual to become susceptible to infection. Now, we've mentioned the chain of infection that it must be broken. Alright, so here are the body's defense against infection. We have non-specific defenses and we also have specific or immune defenses. Non-specific defenses protect person against microorganisms regardless of prior exposure. So, another one, specific, this is directed against identifiable bacteria, virus, or fungi. So, for non-specific defenses, we have intact skin and mucous membranes. So, no wounds, moist mucous membranes and cilia of the nasal passages. Again, if it is moist, then there's less likely that the individual could have dryness of the membranes and mucosa. We have also the alveolar macrophages, saliva, and tears. Okay, so high acidity of the stomach, resident flora of the large intestine, can protect us from any bacteria. Peristalsis, okay, and low pH of the vagina to reduce the presence of vaginal infection. Urine flow through the urethra, okay. So, those are anatomic and physiological barriers. So, now let's have the inflammation. Let's discuss the inflammatory responses. So when we say inflammation, there's local, non-specific defense response of the tissues to injurious or infectious agent. So that's inflammation. It can be recognized through these 5 signs. So we have pain, swelling, okay, redness, heat, impaired function. So often than not, you can recognize inflammation with the term and having itis at the suffix of the word. So for example, appendicitis. So that's the inflammation of the appendix. There's also conjunctivitis. That's the inflammation of the conjunctiva. Here are the stages of inflammatory response. We have the first stage, okay? At the start of the first stage of inflammation, the blood vessels at the site of injury constrict. So this is rapidly followed by dilation of small blood vessels, happening because of the histamine released by the injured tissue. So, again, there will be marked increase in the blood supply, and this is responsible for the redness that you see and heat in the injury site. So, next is that there is vascular permeability, which increases at the site, and there will be dilation of the blood vessels in response to cell death, and release of chemical mediators and histamine. Fluid, proteins, and leukocytes or the white blood cells leak into the interstitial spaces, and the signs of inflammation, okay, could be swelling, and pain can also happen or can be felt. So, the blood vessels, okay, where the bone marrow produces large number of leukocytes, okay, releases them into the bloodstream, and there will be leukocytosis. Leukocytosis happens when there's a large number of leukocytes that's being produced and released by the bone marrow in the bloodstream. Now, after the first stage, there will be start of exudate production, and this exudate is consist of fluid that escaped from the blood vessels, dead phagocytic cells, and dead tissue cells. So, there's also plasma protein fibrinogen, which is converted to fibrin when it is released into the tissue. Thromboplastin and platelets form an interlacing network to wall off the area and prevent spread of the injurious agent. And the major types of exudate, we have serous and hemorrhagic. So the last stage is the reparative stage. Okay, so this involves the repair of injured tissues by regeneration or replacement with fibrous tissue or scar formation. When we say regeneration, this is the replacement of destroyed tissue cells by cells that are or having similar in structure and function. Okay, so there are times that regeneration is not possible, okay, and it occurs by scar formation. So, damaged tissues are replaced with the connective tissue elements of collagen, blood capillaries, lymphatics, and other tissue-bound substances. In the early stages of this process, the tissue is called granulation tissue. It is fragile, gelatinous tissue, appearing pink or red because of many newly formed capillaries. Later in the process, the tissue shrinks and the collagen now contract. So you can see a firmer fibrous tissue, okay, that remains, and that is called the scar. Okay, and it's also called cicatrix. Okay, now let's discuss the specific defenses. So we have antigen, okay, and autoantigen. So when you say antigen, these are substances that induces a state of sensitivity or immune responsiveness. Autoantigen, okay, it is when proteins originate in one's person, own body. The specific defenses is also known as a cellular immunity. And this could be activated T cells like hyper T cells, cytotoxic T cells, suppressor T cells. Alright, so those are the non-specific and specific defenses of the body against infection. Now, let's discuss the ecologic model. Later on, you'll find out that ecologic model has several types. It could be lever, wheel, or web. Now, let's discuss the ecologic model. So, the disease, defect, disability, or death results from the interactions between the agent, okay, host, and environment. Okay, so take note of that. So, agent, host, and environment. Diseases arise, okay, within an ecological system. So, an ecologic approach is necessary to explain the disease causation and occurrences, okay, of the disease. And again, we'll find out the relationship of organisms to each other. So let's now discuss the agent, okay? Agent is any element, okay? Substance or force, whether living or non-living, its presence can initiate a disease process. Let's classify the agent, okay? It could be biologic living agents, okay? We also have an example such as fungi, metazoa, bacteria, viruses, nematodes, helminths. Okay? Now, let's discuss its nature. Because, again, we have the biologic agent. Alright, so the biologic agent has its infectivity, pathogenicity, virulence, and immunogenicity. So when you say infectivity, it is the ability of the agent to enter and multiply in the host. Pathogenicity is the ability of the agent, for example, fungi, okay, to produce disease. Virulence is the ability, again, of the agent to produce the disease. And immunogenicity is the ability of the agent to induce a specific immunity. Okay, so we have another one, nutritive. Okay, so it could either be the lack or excess in nutritional status. Alright, so food intake, take note that these are carbohydrates, vitamins, fat, proteins, mineral, water, sodium, and so on. Again, they can contribute or they can be classified as an agent. Chemicals are pollutants, toxic chemicals, heavy metals, extreme temperature can also be. Okay, so let's classify here extreme temperature as part of the physical, alright? So, again, in terms of physical agent classification, there is the presence of extreme, okay, heat and cold exposure. So, heat, prolonged exposure to the sun, inadequate ventilation, or exposure to hot processes. So, like that of burns, stroke, heat cramps. Cold, on the other hand, is exposure to cold processes or operations. So like we have low outdoor temperature such that of winter. Okay, the effect could be heat loss or even frostbite. How about the atmospheric pressure changes? This is generated by low altitude. So, the compression or bends for underwater. Okay, high altitude. Okay, so you also have supply of essential gases. So, for example, have you experienced riding or taking the plane? Okay, so whenever the plane takes off, okay, you experience you are going to experience some discomfort. Okay, so that's high altitude. All right. Okay. Next we have radiation. Radiation is where ion is produced. So, alpha, gamma, X-ray. So, again, this can be an agent. Alright? Noise. How about noise? Okay, so intense sound above tolerable levels. So, this can also damage our ears, right? So, any noise above 70 decibels can damage the hearing. That's according to Center for Disease Control and WHO. And lastly, we have mechanical. So, this could be forces resulting to tearing, penetrating, speeding objects. So, that's mechanical. So, let's now describe the host, right? We just finished discussing the agent. So, when we say host, we talk about intrinsic factors. So, host factors could be that of genetic, okay? So, the disease or that can run from one's gene, all right? Next, we have the age. We have mentioned the age, who are vulnerable, the very old, young, depending as well in some infections. So, sex or gender, who is more, again, susceptible? Are they males or females? How about ethnic or racial? These are closely related to their social custom and cultural development, like their cultural practices. For example, if and when they are not allowed to eat some food, okay, because it's again part of their ethnical practices. The same thing with their religion. So somehow it can affect their the host susceptibility. How about the family size? Is it better to have bigger family size? And how about having a small family size? So, next you have the nutritional state and its constitution. Okay, so what are the eating habits, practices? Okay, how about the human behavior? For example, is this individual okay, taking care of his health, right? So, how about practicing healthy lifestyle? Knowing what healthy lifestyles are, okay, is not enough, but is there any practice about it? Resistance could either be general or non-specific, okay? So, those are the characteristics of the host. For the environmental environment rather, okay, let's take note that if the host was considered as the intrinsic factor, environment is the extrinsic factor, okay? So, it is the sum total of an organism's external surrounding, okay? It affects the life development of an organism. It can either affect the agent and the host. Alright, so next we have, for example, again, if we have this environment, we talk about the physical, biologic, and socio-economic. So when we say physical environment, this is where the individuals live or work, play or stay, okay? And when you say biologic, we've discussed these are natural sites, okay? We have plants, animals, okay? And for socioeconomic, it involves either rural or urban areas. We also consider the economic development. What are the featured occupation? Okay, are there any social disruption like, for example, war, disaster, earthquake, typhoon, flood? Okay, how about revolution? So we have is there war? Okay, so here are examples of the environment. So, if we put them together, we can have the lever model, okay? The lever model uses the epidemiological triad. You can see here a triangle. It has the agent at the tip, okay, on the side, the host, and then the environment. So, that's how it is initially. But then it says, remember that in the environment, it can either affect the agent or the host, okay? So here you can see that the environment is at the center. So if there is balance between agent and the host, then there's no problem, okay? Because it's balanced. Now, then when can it produce or occur into a problem? Okay, so again, let's take note that in the lever model, there is an interaction between the agent, host, and environment. So again, I will repeat that the environment, okay, in the environment, there must be a balance between the agent and the host. So let's take a look at these figures, okay? So you just can see here, this is the environment. It's always the one holding the beam or the lever, okay? That again, when we say normal, there's balance between agent and the host. It's balance. So here there's increase in this illustration. You can see that there is increase in the ability of the agent to infect and cause the disease in man. Okay, so on this side, you can see the host. Okay, how about this one? You can see that the beam, all right, is not balanced. Again, the proportion of susceptibles in the human population is increased. Okay, so next you have here the environmental change. Okay, a while ago, please take note that the dot here holds an equal proportion between the agent and the host. Now here the environmental change, okay, facilitates the agent spread of either microorganisms, for instance. So again, it is favorable again to the agent. On the other hand, when you say environmental change, okay, if it alters, the host now becomes more susceptible to the infection or to the agent. Okay, so for example, let's say COVID-19, okay? At the start of COVID-19, there is actually the ability of COVID-19 agent to infect and cause disease in man. Okay, and then it deteriorates. Actually, it did not, rather it progresses. This time, as the scientists study about it, it was found that environmental change also can facilitate the spread of COVID-19. Okay, so again, for example, if you live in crowded place and then there's someone infected, then you can also become susceptible to the infection. That's the reason why facilities were made okay, in order for the infected individuals to be placed there, to be quarantined so as not to infect others. This is especially true if you live in a crowded area or slum area, those that are, close to each other. Okay? So, that's how the agent, host, and environment communicates or interacts, okay, and becomes, again, either favorable to environmental change, okay, and make susceptible host as well for the agent to enter. Now, let's move on to the web model of causation. So, here, the essence of this concept is that it affects, okay, actually, it's not dependent on a single isolated cause, but rather develop as a result of change of causation in each link. All right, so you have here, it could be the result of genealogy of antecedents. So, let's say, for instance, this is a coronary heart disease. It's evident, okay, has multiple factors, okay, to promote or inhibit the development of coronary heart disease. Some of these factors are intrinsic, okay, so that's about actually the host, okay. Some components of this are related to stress, medications, okay, lifestyle practices, all right, and can be subject to manipulation. So, there are several factors causing coronary heart disease. Unlike in lever model, where there's only an interaction of the agent, host, and the environment. Here, there are many factors. Next, we have the wheel model. Okay, so the wheel model is consist of a hub. Okay, let's see this one. It has the hub that represents the human or the host, which has a genetic makeup at its core. So, the cause of the disease is through genes. Okay? But it says here that surrounding the host, okay, there are three subdivided, okay, sectors that can be found in the environment. For example, you have biologic environment, which comprises age, sex, body mass index, labor or type of occupation. How about the level of activity, even even smoking. Next, we have social environment. Okay, it could be of socio-economic status like family income, shelter, okay, occupation, okay. How about education? And also, there's also race, okay. And smoking as being influenced by society. Psychological environment, okay, deals with the individual's pain, okay, what's causing pain, and then anxiety, depression, all right, so there. So, for example, the development or having a child with Down syndrome, okay, before an individual gets that kind of condition, okay, there are several factors. So, for example, what has been the age of the couple, okay, when they conceived the child. So, when the mother conceived the child, rather. Okay, so the older the parents are, especially the mother, and if Down syndrome runs in the family, then there is a more possibility that they can have Down syndrome. child. So other factors also can affect. Okay, so socioeconomic, anxiety, and so on. So that's the wheel model. Okay, so again, for the ecologic model, take note that you have the lever model where there is an interaction of the agent, host, and environment. You also have the web model of causation. The disease is caused by many factors, so there's multiple disease causation. And you also have the wheel, where there's the genetic composition of the host that affects, again, the disease development. Okay, let's now move to the standard precautions. So here, let's discuss standard precautions. We have hand hygiene, disinfecting, and sterilizing. So when you say hand hygiene, again, this is considered as the most effective infection prevention measures that prevent the spread of microorganisms. As being told, right, that to prevent COVID-19, everyone must have this hand hygiene as means of protection, okay? So there are also times that after hand washing, okay, so to be able to thoroughly cleanse the hands, the Center for Disease Control recommends the use of alcohol-based antiseptic hand rubs before and after each direct client contact. So this is being practiced in the hospital or clinics in particular. For the disinfecting, okay, you have antiseptics and disinfectants. They are said to have bactericidal or bacteriostatic properties that destroys bacteria. Okay, so you can actually see its strength. It could either be check for the percentage. What's acceptable is 70%. Okay. Commonly used antiseptics are isopropyl and ethyl alcohol. They can also be used not only on hands but on vial stoppers to cleanse it. Vials, that's what you use for okay, to get or administer the injection. So hydrogen peroxides being applied to surfaces. Chlorhexidine also can also be applied on hands. Next, we have the standard in isolation as infection prevention and control. Okay, so here we have the use of, again, we practice hand hygiene proper to using the personal protective equipment. Okay, so here are the PPE, we call that. So, the health worker should have face shield, okay, face mask, of course, wearing the gown, gloves, shoe cover, okay, and there is actually a proper method in doing this one. And I'm sure that most of you have seen this, especially during this time of a pandemic, on how the healthcare providers, okay, care for the individuals using the PPE. Isolation, on the other hand, is isolation is the transmission, okay, based precaution, all right? Okay, so this refer to measures designed to prevent the spread of infections or potentially infectious microorganisms to health personnel, clients, or visitors. So, for example, you can see in the hospital category, okay, you have the category specific isolation. So, there is strict isolation, respiratory isolation, enteric precautions, and body fluid precautions. So, before entering the area, you can see a sign like this one, okay, that you must do the following. You wash your hands, wear PPEs as well. Next is the For specific diseases, we have the disease-specific isolation, where you only provide a single room, okay, for clients having a specific disease. Like delineating private rooms with special ventilation or having negative air pressure. So just like in cases of COVID-19, okay. However, there are also cases where patients can share a room only if they have the same disease. So, as you can see, wrapping it up, microorganisms are everywhere. Most are harmless and some are beneficial. However, many microorganisms can cause infection to susceptible individuals. That is why effective prevention and control of infectious disease is international, national, community, and individual responsibility. So, that's it for our lecture. Thank you for again listening. And we have Kojir's Fundamentals of Nursing Practice as the reference for our discussion. So, thank you. Maraming salamat po.